Good morning, distinguished panelists. Hussein, thank you for allowing me to join this distinguished panel. And if COVID-19 proves anything, it is the fact that the world is indeed now a global village. And whether we like it or not, we cannot stay individual countries cannot stay isolated from each other anymore. So whether it's health problems or health solutions, these have to be global in nature. The COVID-19 has proved that point beyond any doubt, I believe. And that's why the government of Pakistan, the Prime Minister of Pakistan also looks at it as a challenge, but also an opportunity to initiate some global actions that would mitigate the circumstances for third world countries that suffer mostly from such global health challenges. The Prime Minister of Pakistan has called for a global initiative on debt relief. And that initiative has been widely welcomed both by the United Nations and other international bodies. And in consultation with the UN and other international institutions, now Pakistan will convene a group of interested countries at the UN to commence consultations on further steps that can be taken to evolve a comprehensive solution to the debt challenges of developing countries that result from the COVID-19 situation. The Prime Minister of Pakistan and the Foreign Minister are speaking to a number of world leaders to discuss the need for a coordinated and comprehensive solution to the debt issue. In this respect, let me also talk about the domestic steps that the government of Pakistan has taken. The government of Pakistan has launched a preparedness and response plan to suppress and mitigate the spread of COVID-19. And this plan, the initial one, is worth $595 million US, and it's intended to strengthen Pakistan's capacity in emergency prevention, preparedness, response, and relief, and to build health systems for a period of 9 months from April of this year to December of this year. Pakistan has also launched the largest and most comprehensive program of providing financial support to the poor and marginalized segments of Pakistani society. And the government has started rolling out about $90 million of social protection money to the poor. And we are offering cash payments to the the poorest and the most affected segments of society. We have also turned about 1,800 3-star and 4-star hotels in the country into quarantine centers for COVID-19 patients. We have also converted air-conditioned sleeper and business class trains into medical wards, and they have a capacity of about 2,000 hospital beds. In order to deliver the cash payments to the poor, the government has established 17,000 points all across the country. We believe that these will provide about protection to about 12 million families and about 80 million Pakistanis who are expected to be severely affected by COVID-19 situation. On international level, Pakistan also organized the SARC, the South Asian Association for Regional Cooperation, the SARC health ministers video conference on COVID-19 a few days ago, just like we are conducting it. And this conference was attended not only by the SAARC Secretary General, but all member states, including India. We understand that South Asia is particularly vulnerable because it has high population densities, its health system is fragile, and disease surveillance is very rudimentary. And therefore, there is a great need to strengthen our health systems. The Pakistani Prime Minister has made it very clear that he understands that lockdown alone will not resolve the issue. And for a third world country like Pakistan, which has a large segment of population which is totally dependent on wages, on daily wages, a lockdown will in effect bring out a greater problem of poverty and daily wages. That's why we believe in the smart lockdowns, where not everybody and not all segments of society have to lock down, and some of the most essential services can continue. At this time, let me also, in this context, especially mention the support that the government of China has extended to Pakistan to increase Pakistan's capacity to fight this pandemic. And Pakistan also, when China was going through its roughest period of COVID, dealing with COVID, Pakistan also extended its valuable support to China. And the president of Pakistan, Dr. Arif Alvi, visited Beijing in March 2020 as just to express solidarity with the Chinese people. So to sum up, to conclude, this initiative of Silk Road Health Corridor is actually an hour of the need. This COVID-19 should not lead to a blame game. We should be able to turn it into an opportunity to strengthen global health services and global cooperation for health services. I thank you very much, Hussein. Thank you.